Hello, thanks for the opportunity and inviting me. My name is Wang. I'm a Taiwanese hematologist, currently working as a consultant hematologist in Taiwan University Cancer Center. My research is focused on MDS and MPN and MDS-MPN overlap syndromes, mainly CMML. I think we do have much improvements in the field of MDS-MPN and the overlapping syndromes. Significantly, we see many prognostication systems emerging. Say we have IPSSM for MDS. We have the so-called BLAST as presented by Professor Teferi today, published recently and presented today. We have the IPSS revised for myelofibrosis. But the urgent need we need is the treatment, novel treatment options for patients. Over the past 2 decades, we are still asking 2 questions. Do we treat the patients with HMA alone, or do we transplant the patients? And then if yes, how and when to transplantation? Particularly for myelofibrosis and CMML patients, I believe there's no consensus on when to transplant the patients, and this we need to explore. I would take this opportunity to highlight that we Taiwanese have been building up our cohorts, building the Taiwanese derived data and Asian population derived data, particularly APSS presented today as well. But horizontally, we need more connections and collaborations with the Western countries to widen our research and to collaborate. As we are as a small countries in this small island, we don't have that large patient population to conduct large scale clinical trials. So vertically, we do need to dive deeper to understand the pathobiology of those diseases. For instance, CMML, which is largely diagnosed by its phenotype, the malignant monocytosis. And we know it has its own signature mutation landscape, the mutation combinations, for example, TET2 and SRSF2, some without AXS01, some with NRAS mutations. But we do see patients, maybe a third of patients, they have TET2 without SRSF2, but with other splicing mutations. Or they have SRSF2 with AXS01, but they don't have TET2. So what is CMML really? We do need to go deeper, do more basic and translational studies to understand the disease so that we can bridge all these results to the therapeutic side from bench to bedside to really help those patients. I particularly appreciate this very first SOHO Asia to be held in Taipei. We as islanders, we don't want to be isolated. We want to make friends with all people from, and particularly researchers, clinicians from all around the world. So I see this as a crucial step, bridging East Asian countries together with the SOHO society and to the wider Western hematology communities. So ambitious proposal, maybe we do more collaborations with Asian countries first. As European countries, they have EBMT, they have EHA, they have many cooperative trials. We Asians may go together, unite together first, and then we can validate for our data or our findings with our American or European friends on each side. We can validate their findings, they can validate our findings, vice versa. My previous studies have been mainly working on, say, genetic findings or prognostication of MDS, CMML, and myelofibrosis. But now I do hope we can go further. Say, during my PhD, where I did in Manchester in the UK, I studied the SRSF2 mutation, the splicing factors in CMML particularly. It's been studied extensively in MDS, but ours is the very first working on SR2 in CMML, which that could make a great difference, as SR2 is one of the most commonly mutated genes in CMML. And also in some studies, not done in CMML yet, but it was shown that SR2 mutant clones in myeloid neoplasms, these SR2 mutant clones has a particular clonal survival advantage over other clones over the years. So I think this could be a field, a road with potential to go further.